Hello, this is Robin Hendry, and I'm here today to talk about a new policy for a public health issue that can and has affected thousands of children and adults. The topic I would like to discuss is the ease and the low cost of the availability of large sodas and the harm it can contribute, causing obesity and type 2 diabetes. There are many reasons for the epidemic, however, but I will be discussing this one. This needs to be addressed simply because type 2 diabetes and obesity has gotten out of control. In the United States, according to the CDC, the prevalence of obesity in adults was 93.3 million, or 38.8%, from stats taken in 2015 through 2016. For children in the United States, the prevalence of obesity is around 13.7 million, or 18.5%. Also, according to the CDC, the prevalence of type 2 diabetes for adults in 2016 was 21 million, or 8.6%. Type 2 diabetes is rare in children under 10, but in ages 10 to 19-year-olds, there was an increase of 21% in the years from 2001 through 2009. Obesity costs from 147 billion to 210 billion a year. It also costs in absenteeism and lower productivity at work, with an estimation of around 4.3 billion annually. The American Diabetes Association released new research on March 22nd of 2018, estimating the total cost of diagnosed diabetics has risen to 327 billion in 2017 from 245 billion in 2012, when the cost was last examined. This figure represents a 26% increase over a 5-year period. Consuming so much sugar has led to health havoc of great proportions. Sugar-loaded drinks are the #1 source of added sugars in the diet and the single largest contributor to obesity and diabetes. Obesity and diabetes can lead to heart disease, kidney disease, high blood pressure, high cholesterol, and it can increase the risk of stroke and heart attack. The future for adolescents with type 2 diabetes is still uncertain. The condition is so new that scientists don't know what will happen to these kids when they grow up. According to Dr. Kimber Stanhope, a UC Davis researcher who has been working on researching liquid sugars, states consuming added sugar or sugar-sweetened beverages is associated with the increased risk of diseases. She states that our bodies did not evolve to deal with the daily sugar jolt that we give our bodies when consuming soda. If you consume a large soda, it is difficult for our livers to deal with it, so our bodies turn it into fat. People who consume these drinks on a regular basis, say 24 ounces, that would be 2 cans of soda a day, has a greater than 26% chance of developing type 2 diabetes than people who rarely have such drinks. There are approximately 142 calories in a 12-ounce can of soda. And if a person drank 2 cans of soda a day, or 24 ounces of soda, that has approximately 284 calories a day. Now, you may think that isn't much, but over a year that adds up to 103,660 calories a year. Now, let's look at the sugar in soda, depending on which soda you choose. In one can, it can have around 9.5 teaspoons of sugar. Over 1 year and drinking 2 sodas a year, that comes out to 6,935 teaspoons of sugar. That's a lot of sugar that can equal a lot of diabetes and obesity. Some convenience stores have very large cups of soda for very little money. Where a bottle of water may cost you $3 to $4, and you can buy the newest size soda of 150 ounces for 99 cents. Our society needs a new policy, so I am proposing not a ban on soda, but a ban on drinks larger than 24 ounces, and that there is a high tax placed on these drinks. And the tax will go for education and research on diabetes and obesity. We have tried similar measures with education. However, it is difficult to get through to people except through their pocketbooks. By the way, that 150-ounce soda would have 1,775 calories and 1,425 teaspoons of sugar. So if you're aiming for a 2,000 calorie a day diet, that would leave you with 225 calories for some real food. So what could you eat for 225 calories? Well, you can have a small bowl of ketchup. You can have a half a bagel, or you can have 3 eggs. We should not be drinking empty calories. It provides us with no nutritional value and often leaves you feeling thirsty and hungry. I urge you to pass this policy to limit the size of soda that can be sold to no larger than 24 ounces. Also to require a higher tax on sugar drinks. This policy will help the future health of children and adults by lowering health care costs. Soda taxes are modeled like tobacco taxes, which have been hugely successful in reducing smoking and improving public health. Some people may be skeptical of having the government favor one kind of behavior over another, while others worry that tax on soda may predominantly hurt the poor. I believe the government has a duty to promote public health. Obesity and type 2 diabetes are preventable public health problems. I urge you to say yes to this policy. Thank you.